Greetings of the day. I am Dr. Bhavna Barmi, a clinical and a child psychologist, and I've worked with children and people across the world for over 25 years. I head the psychology department with the Fortis Escorts Heart Institute, and I'm the founder of some wellness centers called the Happiness Studios across the NCR and the co-founder of PsyCare A Neuropsychiatric Hospital. I'm extremely pleasured today to be on the Kohai platform and sharing a case study. A case study about a 6-year-old boy who was exceptionally bright in academics. He belonged to an extended family which entailed his grandparents, parents and siblings, with none of them having a history of mental illness. His mother brought him to my hospital with a complaint of increasingly defiant behavior at home and in school, accompanied with temper tantrums. He also exhibited symptoms of perfectionism. When inquired about the recent stressors, the patient's mother revealed about the birth of a younger sibling, which took place a few months ago. Since all the attention went to the younger one, he started to feel lonely and was aggressive towards the younger one. Arguments, especially with the mother, frequently escalated to a temper tantrum, wherein he would throw whatever he saw near him. Prior to proceeding with the intervention, it is an integral part to gauge the severity and intensity of the problem. Since there are no tests available for oppositional defiant disorder, the diagnosis was done on the basis of signs and symptoms that generally suggest a particular disorder. Along with the reports, we started conducting therapy sessions, and we did about 15 sessions on a weekly basis and worked on the following areas of concern. A behavioral management plan wherein he could learn how to improve his behavior and the implications of his behavior and how it affects other people around him. This was very important for him to internalize how it was impacting other people around him. Another thing that was done was emotional regulation, wherein we could help him manage his emotions, especially anger and sibling anxiety, accompanied by making him understand the vicious cycle he gets into, which ultimately causes the disruptive behavior that he exhibits. Healthy coping skills were instilled in him to better cope with such triggering situations. Social relationships was worked upon, wherein the child communicated openly with peers and other children in the family without feeling insecure. Working on increasing the child's positive behavior and managing his challenging outbursts was the motive. Family bonding and parental contribution was also worked upon, wherein I, as a psychologist, reached out to the child's parents for a holistic approach to the child's issues. Parents were taught the concept of positive and negative reinforcement and the minimal use of punishment. Also, maintenance of a structured reward chat and maintenance of brief time inputs. Certain treatment methods that we resorted included cognitive behavior therapy, behavior modification, motivational therapy, psychodrama, unstructured play, and the use of reinforcement. Presently, I'm happy to inform you that he's performing well in school and maintaining his exceptionally good grades as always, and his teachers have started to have no complaints against him. His parents are happy with his improved behavior, which lacks aggressive acts and temper tantrums. He's happy with his younger sibling. There has been no relapse in the context of behavioral modifications for the last 1 year.